The Minister of Health, in partnership with USAID, have been running a 5 years funded project dubbed Defeat Multi-Drug-Resistant TB.
We want to continue to say TB is curable. And that message needs to go and reach to everybody. Don't sign off everybody because TB is curable.
5 years since the campaign to stamp out TB from Uganda started, the country has registered success. The Minister of Health has reported that the recovery rate from multi-drug-resistant TB has moved from 60% to 80%.
We slowly began to improve the TSR from 62 to 70, and now we are at 80% currently. So meaning that currently, of every 100 patients that we manage, 80% are cured.
Meaning the new project coming on will just have to improve so that we at least take the target of 90%. We are able to now treat people, and out of every 100 people who get sick with drug-resistant TB, 80% have been cured.
Despite this success, TB remains one of the top killer diseases in Uganda.
We lose more people to TB, the third highest contributor to TB deaths in Uganda.
We have 556 patients with MDR TB who are being treated. However, this figure is only about 40% of the expected cases.
The expert explains why a TB patient, let alone becomes resistant to drugs, and the cost implication to the taxpayer.
It is a lab diagnosis. It means that the germ is not dying despite the medicine being taken.
TB which is not responding to the antibiotics in sufficient amounts and quantities which given.
The government, through Global Fund, spends about 14 million shillings to manage one patient with MDR TB. That's a lot of money. While for the counterpart, sensitive TB, the government spends about 2 million shillings.
It is expected that by 2030, Uganda will have eradicated TB.
We have instituted a drug resistance survey, and this survey is going to look at the burden of MDR TB in the country. This is due to start August this year.
The Minister of Health designed an approach codenamed CAST TB, which is actually standing for Community Awareness, Screening, Prevention and Treatment to end TB in Uganda. This is aimed at seeing that we engage the community members to see that we look for people who have TB or nasal leprosy, and we actually initiate them onto treatment.
The campaign to fight TB has been boosted with more $17.6 million.
This project was awarded end of October last year, 2021, and we have been in the transition year with the Defeat TB.
The mandate to carry on the fight has been handed over to the Infectious Disease Institute based at Mulago Hospital under Makerere University.
With the award to IDI, what it means is that a Ugandan organization has the capacity to do this work. So I hope you're as excited as myself that a Ugandan organization has grown to a level where it can be trusted to run a complex 5-year project in the area of TB.
Iganga, Gulu, Sorota and Mulago hospitals have been singled out of the 17 hospitals in registering success in the treatment of TB. Jingo Francis, NTV.